There's a live look from the Anna Spanish Head Resort Hotel in Lincoln City. Thanks for watching Afternoon Live. Younger women are experiencing warning signs of heart disease and are either being misdiagnosed or ignored by their doctors. Why is this happening? Well, here to talk about what you should be looking for is cardiologist Dr. Ernst von Schwarz is back with us. Dr. Ernst, thank you for joining us.
Thanks for having me, Kara.
And talking about this, it's been reported that heart disease is the #1 cause of death for women in the U.S., and it's younger women as well who are being affected.
Absolutely. We see more and more young women. And the problem, as you mentioned, Kara, is number one, they present with what we call atypical symptoms. Number two, that leads then to a delay in the diagnosis. And number three, most importantly, often a delay in possible treatments.
So what are the warning signs to take seriously?
Yeah, that's a whole tirade, of course, of different symptoms. And in women in particular, especially in young women, we have what we call atypical symptoms. So not the typical chest pain or shortness of breath or edema in the legs, but oftentimes in women, an early sign for underlying heart disease could be nothing else than just fatigue. And fatigue is so widespread, of course, as you know, but it could be a sign of a weak heart or of lack of oxygen in the heart. And we have a lot of young women, they run from one doctor to another because they feel tired and fatigued. And everyone said, well, maybe you work too much, get some more rest. But the underlying reason could be a weak heart or lack of oxygen caused by coronary artery disease. And oftentimes we as physicians don't think about it. That's one big thing, of course, to consider. And the other one, as you know, we have more and more data now about migraine and its relationship and association with the development of, in particular, ischemic heart disease.
And you've had experience with this, I know, with some of your patients, even ones who are in their 40s, not even 40.
Even in their 30s nowadays. I mean, of course, in young people, we all know about the possibilities of virus-induced infections of the heart or inflammation like myocarditis. But besides that, we have a lot of young people with familial cardiomyopathy, meaning they have a genetic disposition to develop heart failure because maybe their parents, grandparents, or someone else in the family had it. But sometimes we see even spontaneously occurring weaknesses of the heart, or some congenital irregularities of the heart rhythm, which are often not diagnosed in childhood, but suddenly because they pass out, they faint suddenly, and then we'll do an EKG and we see an abnormality, which in some cases requires immediate attention and therapy.
Talk about even this patient that you had who, heart disease at the age of 29, wanted to have a baby. There is something that can be done.
Absolutely, yeah. And that particular patient had actually two conditions. Number one, she had a valvular dysfunction where one of the heart valves was severely leaking, and that might have been the result of maybe an infection from the teeth or in the mouth in childhood. And in addition to that, she had what we call cardiomyopathy, meaning a heart muscle weakness. And she was basically not diagnosed for many, many years, despite the fact that she was running from one healthcare provider to another and complaining about weakness and shortness of breath, and she can't do what she want to do, until we did an echo and ultrasound of the heart and then could make the diagnosis of the leaking valve as well as the cardiomyopathy. And she was operated at the age of, I think, 31 or so, and she did extremely well. But she still had some underlying heart failure, which up to this day now, which is like 10, 12 years later, requires treatment, including she had a defibrillator implanted and she needs frequent monitoring and follow-ups and medications on a daily basis.
But I was also reading before she came to you, many times she just heard, oh, you're too stressed. Oh, you drink too much coffee. All these other things that they thought were the problem when it really was truly her heart. How can women be better advocates for themselves when they really feel like there's something else?
Yeah, I mean, that's really a challenge. And I include myself in that. Sometimes, of course, we don't take symptoms serious enough. I mean, we have a lot of people coming every day and they complain about some irregularities, palpitation, the heart is skipping a beat. And 90% of those are completely harmless. However, if you have any symptoms like that, at least have them checked. And what we do usually is nothing major. We do very simple, non-invasive tests. We get an EKG. Oftentimes we do an echocardiogram, an ultrasound or a stress test, sometimes a Holter monitor for a couple of days. So these very simple, non-invasive tests can provide a lot of information, and oftentimes they might be just done to rule out an underlying problem, but in rare cases, but critical cases, they can lead to a diagnosis which might save someone's life. Mm-hmm. So if you have any of those symptoms, such as palpitations, shortness of breath, extreme fatigue, especially if it's new onset of those, go to your doctor and maybe consider be seen by a cardiologist and have it checked out.
Always great information. Thank you so much, Dr. von Schwarz. Good to see you again.
Thank you for having me on, Kendra. All the best to you.
And we'll have more information about Dr. Ernst on our website at KATU.com. Don't go away. We'll be right back.